But I would love to hear if you have questions or any reflections or just things that jumped out at you of like, wow, that's going to be a game changer for me in the way that I engage with patients or in the info that I give them.
This brings to mind this patient had, when they were going through chemo, they had a cookbook recipe book in their room, and it was a cancer-specific cookbook.
Yeah.
And I'm interested if you have any cookbooks that you have looked at and and would recommend to patients.
The Cancer Fighting Kitchen is a good one. That one doesn't go the ketogenic route. However, that nutritionist is at a large cancer center and has her recipes organized by side effect. So she has things for constipation and diarrhea and your taste buds being out of whack and mouth sores and all kinds of stuff. I can't remember what her name is, but I'm gonna send Lisa, an email that has some research points in it, and I will also include the Cancer Fighting Kitchen.
Yeah, awesome.
Yeah, I also just utilize a lot of Google because there is so much conflicting information about, I talked to an oncologist who's like, he literally listed sugars in the list of things to tell me to eat, and I just thought, people are following that. And I mean, even in the infusion center, when I went in there a couple times to get fluids, and they're like offering me candy or hot chocolate, I was like, Mike, hold me back. Like, I cannot handle this. But there is a lot of conflicting information, and I think a lot of it too has to do with just like a patient figuring out what works for them. So some of those recipes from Cancer Fighting Kitchen might be really beneficial for one person and like not for someone else. But I will think about if there are other books that I have as well. Yeah. Yeah. Hi, by the way.
Hi, yeah, sorry, I'm a little late.
That's okay.
So you shared a lot of great information about things that you found that are helpful for patients to do. What do you do when you talk to people who ask you questions from things they've done in their own research that you maybe specifically know are either harmful or just not helpful or questionable?
That's such a good
question. That just the opposite side of it, because this is what you can say, do this, but do you approach the, but don't do this is known to be unsafe, we don't have enough information.
Right.
That's experimental, or that whole side of it.
Yeah, I think that when I'm talking with people who are going through the journey right now, that maybe don't have much of a background in medicine or physiology or whatever, I kind of relate to them from the common sense standpoint and talking specifically about like the PET scan and okay, so what does this tell us, and help them get to that place of like, oh, the cancer gets the cancer cell, or the sugar gets the cancer cells excited, and I'm like, yeah, so what kind of implications might that have, and kind of help them get to that place. And then if they're like, but I love sugar so much, then I just say, this is what it's doing in your body. Even in a body without cancer, causing inflammation and decreasing immune function and all this stuff. So if we already have inflammation and decreased immune function and blah, 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 then that's a no-no.
And a lot of people will order things over the internet that have unknown ingredients or herbs and various things from other countries that, I think there's mostly lack of evidence. Some things we know are harmful, but some there's just a lack. So
yes.
Do you try to tell people stay away from things we don't know about when they want to try them?
I don't actually. I am a pretty firm believer that a lot of the more naturopathic supplemental stuff, because it doesn't have big pharma funding behind it, you're not going to find a whole lot of research on it. So I think that anecdotal evidence is very valuable, and I would just research all that I can. And if I read a bunch of stories of people that are like, I took ginseng and it totally helped with chemo brain, and someone else is like, oh my gosh, me too, then I would test that and think okay, let me see how this works for me. Because I think the more I learn about the kind of two sides of the medical coin, I'm like, I don't expect to see a lot of that stuff in published research, but the internet, there are people talking and I listen to them, and if they seem like they're totally bonkers, then I'm not necessarily gonna take their advice super strongly. But I think that there is still value to stuff that does not have clinical research behind it, just because that whole system of kind of funding and pharmaceutical stuff is really complicated. So we can't just rely on that. Yeah, does that answer your question?
Yeah.
Okay.
Can we?
Yeah, you have to go.
But thank you so much.
Thank you so much for having me.
Awesome.